Now your heart, whenever you have a heart, like pain in your heart or something affecting your heart, well, referred pain is a pain at a site different from where it's actually happening. So remember, your heart is actually here. Your heart isn't in your arm. So this is why another common thing is not only like tightness, like it feels like a squeezing in your pec major and chest, but also maybe like pain, sometimes numbness or tingling in the arms that are along the left arm. If people who have the interesting thing is like people who have the heart flipped around in their body, they actually have it in the opposite side. That's kind of cool, but yeah, it's not cool to have a heart attack. But referred pain refers to like, okay, sometimes when the organ is being affected, it's kind of weird. Your organs, when they experience pain, they kind of project it onto other sides of your body that aren't actually the locations of the organ. So it's often common in myocardial infarctions. Now, let's see. Again, we're kind of over time. Yeah, so I think and that's the other thing, it's really tricky because again, it's COVID and whatnot. Especially since they found out it affects the clotting and other things as well. And that clots can cause occlusions that could potentially cause heart attacks. Yeah, that's kind of weird. So which cardiac, or actually, real quick. Okay, so which coronary artery blockage would be the deadliest? So most of you said circumflex, or actually most of you said right coronary artery, some of you said left coronary artery. And actually it's the LAD, because interesting thing too is that the LAD is like, where does it supply? The left ventricle. So what does the left ventricle pump to? It pumps to the, again, to the rest of the body, right? So that's a cool thing. Okay, so then heart attacks the symptoms are the same in men and women. So interesting thing, true or false? Okay, so the answer is false, because again, so it's very interesting between men and women. So the interesting thing is that men develop MIs earlier and women develop it later. And it's very interesting. They think the major reason for this is that estrogen levels are associated with like protecting the heart, but actually that might be a good backpack question. But the interesting thing is that more women die from MIs. So it's even though they developed it later, 36% of men die within 5 years of a myocardial infarction, but 47% die within 5 years after a myocardial infarction. So heart attacks are more deadly in women. So the interesting thing is that chest pain and discomfort is common in both. And what we have here is that for women, they're more likely to experience like the shortness of breath, so the gasping maybe not as dramatic as in that sort of video, but also like things like nausea and vomiting, and especially the interesting thing is like back pain. That seems to be very common in women compared to men. Okay, so then the interesting thing, I did mention that sometimes myocardial infarctions occur without noticeable symptoms. So things like this is an interesting thing. These people have a myocardial infarction, then they have like and then they walk around, they walk it off, and then it's only when they come in later for complications, maybe they're have shortness of breath or have early stage heart failure, and then the doc hooks them up to an electrocardiogram or they do an echo on them, and they found out, hey, something happened to your heart a long time ago. I have all the scar tissue. So this is what we call a silent MI. So let's see, I think this is a good place to answer that LAD question. So why is it called, this is also called the widowmaker. So this is the deadliest coronary occlusion. Why? Well, where does the LAD go? The LAD, notice it goes to the left ventricle. And remember that left ventricle has all that muscle tissue. So all that muscle tissue is very important for pumping all that blood to the rest of your body. So this is why this is the most deadliest type of myocardial infarction, because your left ventricle, it does all that heavy lifting. So therefore, it's important to keep your left ventricle healthy and that LAD supplying blood to your left ventricle.